And good evening, everyone. Thank you for taking time out of your evening to join us for the Plantrician Project's Town Hall on soil, human health, and the environment. We are really honored to host Dr. Monica Aggarwal and Jeff Tkach, both good friends of mine this evening, to have a really dynamic kind of in-depth conversation about a topic that's been rising in the plant-based world. And really, really important topic, and that's why we wanted to tackle this at the end of the year. We believe that, conversations are really the beginning of change, and a dynamic, open conversation allows us to highlight the gaps and then begin looking for shared solutions. And ultimately, as we all know, it's collaboration that leads to long-term change. And so the conversation this evening between myself, Dr. Monica Aggarwal, and Jeff Tkach also represents a collaborative relationship that we've developed over many years, myself with Monica and Jeff. And so the fact that we're all here together is evidence of the power of collaboration, and we'll talk more about some of those collaborative projects that we're doing together. We're excited that you've all joined us at the end of the year, especially at the end of some challenging years. On behalf of the Plantrician Project, our board of directors, we just want to say thank you. And we wanted to host a town hall like this to say thank you and appreciate your support through the years and in the various aspects you've supported the Plantrician Project, including attending our conferences, the amazing support that we get through sharing our resources, and through your generous donations that have helped us reach so many people around the world with the tools and resources that we've developed through almost 10 years of work at the Plantrician Project. And yes, next year we're going to be celebrating our 10th anniversary conference. Seems like just yesterday, but I'm actually 10 years older since our first conference, and we'll be celebrating together, hopefully live in California. If you'd like to support the Plantrician Project in any way, the links will be in the chat. Our team will put those there. You could always go to plantricianproject.org to support the projects. We have some really exciting projects that we're endeavoring to take on next year. One project we'll talk about in just a few minutes with the Rodale Institute is a live immersion for healthcare providers on the Rodale farm to really kind of dig into this intersectional conversation between healthcare and agriculture and soil and human health. And we're excited about continuing that relationship with the Rodale Institute and other opportunities that we have to dive into this agriculture and human health, including working with Monica on her new project that we'll talk about this evening. But perhaps the most exciting project to me is an initiative we've called Plantrician U. We decided that we really need to reach the next generation of healthcare providers. There was an interesting study that came out that found that when medical students enter their first year of medical school, about 80% recognize that nutrition is important. By the time they reach the year 2 in their medical education, that number is 0. So we have trained out of them their interest and recognition that nutrition is important. So we've started an initiative called Plantrician U. We'll be launching it beginning of Q2 2022. We're going to take all of the materials that we've ever created or will create in the Plantrician Project, every conference, everything we've ever written. We're going to put it on a platform and give it away for free to every healthcare professional student in the world. Our goal is to reach 100,000 healthcare professional students in the first 2 years, 500,000 in 5 years, and more than that in the years that follow. We really want to reach that next generation. We also want to create a platform that allows us to mentor and come alongside of the next generation of leaders as well. And we believe this will be one of the legacy projects of the Plantrician Project. So more to come. Watch for ways to support that and join with me in reaching that next generation. So this evening, I really wanted to structure this conversation a little differently, and it's my sincere pleasure to, welcome Monica and Jeff. And so often these conversations around the environment, healthcare, agriculture, are fear-filled and paint a dark future. But tonight, I really wanted to focus on the inspiring idea that systems have the capacity to regenerate. And when a system is presented with the right inputs, the right environment, and the right protection, the system can regenerate faster than we might recognize. We've seen this, in the many years that most of us have been doing lifestyle medicine, that bodies have this amazing capacity, this agility to regenerate and heal faster than we might expect. Decades of wrong choices can be resolved in months of healthy choices. And similarly, as we'll see with agriculture and the soil, we can abuse the soil for decades, but when we give it the right inputs and the right environment, soil and the environment can also regenerate. And so we'll talk a little bit about the challenges in healthcare, agriculture, and the environment, but our focus this evening will really be on the system's ability to regenerate and the inspiring good news that when we do the right things in agriculture and in healthcare, we can see a different future in a very short period of time. So with that, I'll welcome Dr. Monica Aggarwal and Jeff Tkach to the platform, and just want to thank you both for joining us this evening. You both are amazing leaders, influencers, gifted thinkers and writers, and I consider it a privilege to be here this evening with you, and I really want to honor all the work that you've done. So maybe Monica, if you would start and just share with us, first maybe your inspiration for stepping into lifestyle medicine, and then secondarily stepping into kind of this next generation entrepreneurial world that you're moving into as the chief medical officer for a farm. So why don't you just take a few minutes and share that with us? Thanks.
Oh, thank you so much, Scott. That was such a nice introduction, and I'm honored to be friends with you and just learn and be with you. It's been such a pleasure and a nice journey. So, and I'm thankful to the participants and looking forward to having this conversation. So, um, I'm a cardiologist. I have been in practice for about, God, embarrassingly so, or scarily so, almost 15 years now. And so, about 10 years ago, I developed an autoimmune condition I was told that I had a debilitating form of it and that I had an overall poor prognosis. I was put on medications. I felt lousy. I got better, but I felt worse. I had one of those sort of doctor becomes the patient scenarios, and I was very humbled. The worst part of it was I remember sitting and being in the doctor's office feeling like I was about 2 inches tall, and the doctor saying to me that I had an incurable disease and that I just needed to get used to it. There was nothing that I could do about it. And that's really a hard thing to say, and I will hear and to hear. And I will tell you, I have never said that to a patient because I think that that's hard. Because I think the one thing that we can offer patients is hope. It's not that the disease that there's going to be sometimes the course we all sort of know that it's going to be if you have cancer and it can't be cured. I get that, but we still don't want to take away people's hope and their and that's sort of what was taken away from me. So I started on my own journey towards health by trying to figure out if this is truly an incurable illness. I was diagnosed with debilitating form of rheumatoid arthritis with significant joint pains. When I first was diagnosed, I was unable to sort of walk even and climb the stairs. I had to learn. I decided to learn on my own about nutrition and lifestyle and the impact of stress. I learned about the microbiota. I traveled around the country trying to learn about all of these things, and I changed everything. I changed how I ate, how I slept, how I exercised, how I meditated. I started meditating. It's more like it, and I really learned to just calm my body, and I healed. I'm 10 years, or I guess now I'm 8.5 years off of medications for rheumatoid arthritis, and I'm proud of that. So as a cardiologist, who has rheumatoid arthritis, it changes everything because you start thinking, well, gosh, I've given out so many prescriptions for statins and told people that they need stents and this is the options. But then when you start thinking about things in terms of your own illness and how you changed, you start thinking about why can't we do that for everything? So it really changed my entire practice. I joined academics at the University of Florida, and I started a prevention practice there, and I started doing research because I wanted to understand, is this all quackery? Did I actually just get better randomly, or is there some science to this? So I started doing science and collecting the data on patients and showing and publishing that actually, look, what we're doing actually works. The mechanism is the microbiota often. There's so much relation to stress and inflammation, stuff that we may talk about today, but that was sort of that process. And sort of long story long, so I went for 5 years. I've been 5.5 years now at the University of Florida, and My husband and I have been married 22 years now, and he's moved for me 5 times. And 6 months ago, he said, I can't live in Gainesville anymore because it's not great for me in IT, which he does IT. So we moved out of Gainesville, and moved to Orlando. And so that changed things for me. I still do research at the University of Florida, but I came to Orlando and sort of gave me a chance to almost reinvent myself. I've always wanted to do farming medicine work, and sort of the concept of teaching people how to eat, but at the level of the farm, growing it, picking it. There's something called hortiphoria, isn't it? The joy of gardening and sort of making your own food, taking the food from the plant and then taking it and cooking it and then eating it, and then just how that changes you. So I changed my practice when I went to University of Florida, and now I'm redeveloping myself again. I've just signed on with a wonderful farm here in Orlando called the Four Roots Farm, where we are working on that generation, which is, a great, that's why I'm so excited to talk to Jeff, and really just talking sort of about two patients and trying to understand the connection, and to do studies and understand the connection between not even just soil health, but seed, soil, plant, nutrient quality, and how that impacts clinical medicine, and how people can get better and their outcomes can be better when we adjust and modify those beginning portions of of the cycle, because it is a cycle. It starts at the level of the seed. It starts even maybe before that, arguably, and of the ground and the earth and the soil, and then it goes all the way till when we eat it and how we can use it to heal our bodies.
That is beautiful. Thank you, Monica, for sharing. Hortiphoria. I love that. That's a new word for me. I learned something new from you tonight. Thank you.
I don't think it's a real word. I don't think it's a real word. I think I've made it up, and I've been using it for years, though, and so you can take it as a Monicaism.
I love it. Thank you. Thank you. And Jeff, you have a similar story. Why don't you share with everyone your story and kind of your inspiration for diving in deeper into this soil and human health?
Absolutely. Yes. And prior to tonight, I had never heard Monica's story. And so I fear that my story is eerily similar, Monica. So I've been around the work of Rodale Institute for almost 20 years. I had spent the first part of my career working in the media industry, working for the Rodale, what is formerly known as the Rodale Publishing Company. Our founder, J.I. Rodale, started a for-profit company in 1942. It was arguably one of the largest health and wellness media companies in the world. He also started a nonprofit. At the time, it was called the Soil and Health Foundation, launched in 1947. Today,
wow.
we're known as the Rodale Institute. And so I had been around the organization as a media executive for 16 collective years, and had always been drawn, like at a soul level, to the work of the Rodale Institute. I had been around the Institute peripherally because of my work on the for-profit side. I had spent time at the physical headquarters. And every time I would visit, I would feel more and more compelled. And I got invited to serve on the board of directors in 2015 while I was the vice president and managing director of Prevention Magazine, which was a huge honor. So I got to have this amazing job that was sort of at the zenith of my media career, while also serving on the board of directors of the nonprofit. And much like Monica, I fell ill. So at the time I was 36 years old, and one day got sick and just never recovered. I got flu-like symptoms that turned into 4 months later me having to go on medical leave. And it was arguably the lowest time of my life, frankly. I went through 6 doctors and probably over $50,000 of out-of-pocket expenses, not to mention the lost income from having to go on medical leave, and zero answers. No doctor could tell me what caused my health collapse. And there I was on medical leave and feeling really depressed. And a friend of mine, who is actually the CEO of the Rodale Institute, said, why don't you seek out what's called a functional medicine doctor? And so he gave me the name of a doctor that practices something called functional medicine. I went to see that doctor. He spent 2.5 hours with me on a Saturday morning, and he came to the conclusion that I had chronic Lyme disease. And I said, well, now what, to the doctor? And he said, well, Jeff, you work around the Rodale Institute, so surely you understand agriculture and how organic agriculture works. He said, listen, you're now 4 or 5 months into this ordeal. There's no prescription I could write to you that's going to cure you overnight. He said, and I'll never forget this, he said, we're going to farm your body back to health.
Yeah.
And he began to draw parallels between regenerative organic agriculture, which is a systems-based approach to farming, and functional medicine, which is really a systems-based approach to medicine. And that doctor began to unpack things like diet and lifestyle and meditation and acupuncture and herbal therapy and ozone therapy and sauna treatments and hot and cold exposure and this whole like myriad of systems that eventually farmed me back to health. And I watched this whole process unfold over months. And frankly, it took a couple of years, but it was really that moment in that doctor's office that day where something lit up in my soul. And I said, you know, when I get better from this illness, I want to devote the rest of my life to this. And that July, I resigned from my media work and became the chief impact officer of the Rodale Institute in July of 2017. And I've been on a journey ever since. I'm now a fully healed, high capacity person again. I'm an athlete. I'm a leader of this global nonprofit that's doing amazing work. But I feel like that illness was really a gift to me in so many ways. And frankly, it introduced me to you, Dr. Stoll. So I'm really grateful for this whole journey that I've been on. And Monica, I totally share in your story. So thank you.
Yeah, thank you both for sharing, for your transparency. And your stories are so important because I think it inspires hope, not only for individuals, but also for our systems. And the research on hope is so fascinating. We don't have time to go into all the research, but they've done functional MRIs on people that have hope, and it activates the part of their brains that are involved in solutions-based thinking and future-based strategy. All the executive functions that are necessary to look for a solution and then walk out a solution. And so that's what's so exciting about your stories and about our conversation tonight, because as you were saying, Jeff, we're looking at systems. And this is what I love about T. Colin Campbell. He's helped all of us to understand the concept of reduction and compartmentalization, when in reality it's an entire whole system. And even as we look at health and healthcare, just as you said, Jeff, we're really looking at farming ourselves back to health. And we can't just stop with prescribing a diet in our practice without beginning to think about the whole of the system, going all the way back to, as you said, Monica, the seed and the soil and the plant. And so we'll continue with that beautiful thread that you outlined this evening. I would just like to spend a couple of minutes for maybe some of the people on our call and this evening, just highlighting some of the challenges that we're facing. And there's plenty of research, that documents the challenges in healthcare and the challenges in agriculture. And as you said, Jeff, the parallels are uncanny in many ways. The same system, the same reductionistic thinking that led to problems in healthcare has also led to the same problems because of the same causes in agriculture. So maybe, Jeff, if you'll start, just outline some of the current challenges in agriculture, the environment, talking maybe about erosion, nutrient depletion. And then Monica, I'll ask you to follow with, some of the challenges that we all are, especially as physicians, very aware of regarding the non-communicable disease burden, healthcare, and global health of populations. So, Jeff?
Sure. Yeah, absolutely. So our founder, J.I. Rodale, wrote some words on a chalkboard in May of 1942. So over 75 years ago, he said that healthy soil equals healthy food equals healthy people. And that's been the mission statement of the Rodale Institute ever since. The United Nations recently published a scientific study that suggests that if we continue to farm the way we're farming now, using these chemical, conventional approaches to agriculture, these reductionist approaches to agriculture, we have some 60 arable growing seasons before our soils become so depleted that we can't feed the world. And concurrent to that, I do believe that as the soil goes, we go. So we've seen this parallel path as we've mechanized and monocropped our agricultural systems and depleted our soils. We've also seen a concurrent collapse in human health. We've seen, in 1960, we were spending something like 3 times as much of our GDP on food than we were on healthcare. And today those numbers are actually flipped. We're spending 3.2 trillion on healthcare than we are to the 1.6 trillion on food. And so, that idea of as the soil goes, we go, we've continued to see that play out again and again and again. And these broken agricultural systems seem to be, contributing to the collapse in human health. But then there's also the environmental piece. So chemical conventional approaches to agriculture are causing significant erosion, pollution to our water and our air. These chemicals are leaching into groundwater. They're ending up in human bodies. And so there's tremendous studies that are showing these agrochemicals that are ending up in human tissue, and we're able to determine that through some pretty conclusive testing. In addition, we're walking around with what we're calling hidden hunger. So as our soils become more and more depleted, the plant's ability to uptake nutrients becomes mitigated, and therefore a lot of the crops that we're consuming today are dramatically less nutrient dense than they were just some 40 years ago. So that's a little bit about the picture of where we stand today. However, I know we're going to dive into the solution, and I'm frankly, I'm very hopeful.
Yeah, that's great. Thank you, Jeff. And Monica?
So, it's interesting. When you have this sort of state of the healthcare, state of the union kind of, it does feel sad and overwhelming. But I do want to, just highlight that we are going to get to these great solutions. What's the problem? And the state of healthcare right now, everyone's dying of heart disease. 70% of the country is obese. I did some statistics today for a grand rounds. 45% of the population is pre-diabetic or diabetic. 10% of the population has high cholesterol. We've just forgotten as a society about the importance of what we do. It's become a different society. 50 years ago, we were focused on maybe the family more. Now we're focused on our careers, myself included. For years, it was all about how I was going to work, and everything else would fit in. And what I have learned over the last 5 to 10 years is that that's not the case. And so that the problem is that because we've made the rest fit in, we've sacrificed our health, isn't it? So we eat faster, we eat processed, we eat instant. We've forgotten actually how food looks. I was giving a talk once recently where people didn't know that garlic came out was what garlic looked like. And that's not a criticism of the person. That's just sort of the situation we're in right now, where it's just that people are so used to seeing things in jars and in bottles that we've sort of forgotten what real food looks like. And so our healthcare system right now is focused on how to treat illness and not how to treat people before they get sick, or how to help people before they're sick. And that's something that I speak about a lot, which is that we focus on acuity-based care versus value-based care, sort of focusing on primordial prevention, sort of the prevention before we get sick rather than when we actually get sick. And that's something that I think there's slowly going to be a shift, because now more and more insurance companies are listening to people like us that are saying, you know what, wait a second. We don't want to take care of people when they're sick. We want to take care of them when they're healthy so that they never get sick. And then just connecting to Jeff a little bit is that, we have to go back so much further than just the food in the grocery store, and sort of remembering that what we're doing to how we make those plants and how do we make them healthy. And I'm sort of obsessed with the microbiota of the human, but think about which is the gut bugs of the human and how those affect your body. So imagine that we're also have to think about the gut bugs of the soil that grow our plant, right? Because if we don't have healthy gut bugs or healthy bugs in our soil, then we don't have healthy plants. So it's this huge process from beginning to end of sort of appreciating that if we're depleting our soil, we're depleting our body or the soil of those bugs that then allow that plant to grow strong. Then that we take that plant and we eat it, and it is so low in phytonutrients, and then our own gut can't then create those healthy gut bugs. And so it just continues to go on. And so sort of that link is what we're, Jeff and I and Scott are all trying to focus on, which is that we have to start earlier and we have to get to people to make greater impact.
Yeah, wonderful. Thank you, Monica. And one other challenge that I'm just going to highlight and throw out, we won't talk too much about it tonight, but I think it's really important, is that we've developed a cultural mindset, I think coming out of World War II. Frank Sinatra's song is the classic, I Did It My Way, where we've focused on one generation. I know it's everybody's singing it in their head now, right, Monica? And that single focus generation of like immediacy and instant gratification has caused us to forget that we need to think generationally about our lives. We're stewarding soil for the next generation. We're stewarding finances and healthcare, or even our own bodies, for the next generation. And so we've lost this generational view of life, this stewardship mindset that needs to be reinserted into the conversation.
Yeah, I mean, even if you think about it in terms of family life, like because our life has become so instant and we're running here, we're running there, there's not the focus on the meal, isn't it? Like how many people are actually sitting now and having their meal as a family? I read this great article and it was saying that the one thing that kids remember about their childhood is that they sat down and had meals together, and we've sort of lost that. And if we sort of remember to go back, that if we start by cooking together as a family and then we eat together as a family, that's also part of the process, right? Because it's a process of eating healthy food, and then it provides our kids with this baseline of eating and cooking, and the processes, it becomes part of their life. And then there's the hope and joy that comes from that eating together, which then goes back to the MRIs with all the so it's like all is this massive cycle. Like the circle is awesome.
I know, it's about relationship, connection, and community at every single level.
Yeah.
And so, why don't we start with the relationship and community of the soil? Because soil is beautiful, it's wonderful, it's mysterious, it's far beyond what any of us can comprehend, and it's this dynamic community, right? So maybe, Jeff, you can help us dive in at the soil, and we'll start building out of here, talking proactively about soil solutions, but maybe you can give us a little background on the soil.
Absolutely. And Monica alluded to it a moment ago, but let's go all the way back to the Latin root for the word soil, which is humus, which ironically is the same root for the word human or humility, ground or being. And I think that's a profound connection. I think there is an inextricable link between the soil and the human microbiome. The science at Rodale is proving that out every single day, that soil is alive. It's teeming with life. In fact, it's arguably the most complex ecosystem on the planet. The soil is more complex as an ecosystem than rainforests or than the bottom of our oceans or the mountaintops. I mean, soil is alive. There's something like 10 billion microorganisms in just 1 teaspoon of healthy soil. And so if those microorganisms don't exist in the soil, then guess what? They don't show up in our own human microbiome. We need that diversity, the biodiversity, to be healthy, functioning humans, but we also need that in the soil. The more biodiverse our soil is, the more alive it is, the healthier it is, and therefore the plants growing in that soil are healthy too. And they can take the maximum amount of nutrients. They can also sequester the maximum amount of carbon out of our atmosphere. And so we need soil to be alive, and we need to continue to build that life. We need to build the microbiology. And our founder, J.I. Rodale, knew that. And that's why he said that healthy soil equals healthy humans, and even a healthy planet, I think he would add today. And so our job as farmers, it's actually not to grow food, it's to grow healthy soil and healthy people. So we as farmers need to reframe that idea that our job isn't to actually grow commodity crops. Our job is to grow healthy humans. And we do that by focusing all of our efforts and energies on maximizing the health of the soil. So that's really the thesis of Rodale's work. It's helping farmers to maximize the health of the soil.
Yeah, and that's a paradigm shift right there, Jeff. Farmers farming soil and humans and not plants.
That's it.
That's amazing. And Jeff, going back to that kind of original idea of, regeneration of a system by inputs, environment, and protection, maybe just start laying out, and we'll go into this deeper. What are the inputs? Kind of what is the environment and protection that lead to a regeneration of soil, like the embodiment of life in that soil?
Yeah. Well, I think the exciting thing is that everything a farmer needs to maximize soil health is on the farm already. We've been so indoctrinated by big agriculture or by big business, this idea that we need to bring inputs into a farm in order to maximize the health of the soil and grow maximize our yields of what we're growing. So in other words, all those synthetic pesticides and herbicides, we've been sold an idea, and our farmers have been, frankly, they've been incentivized for the wrong behaviors. At Rodale Institute, what we're espousing is everything you need to maximize soil health and productivity on your farm, it exists on your farm. It's things like cover crops, making sure that your soil is never left brown and bare. Right now in Pennsylvania, it's December. If you come to the Rodale Institute, to our 333-acre campus, guess what? It's green. It's teeming with life because we've got cover crops that were planted in the late fall, and those crops are making sure that that soil stays alive. It's the photosynthesis process continues all winter, and we're building soil fertility. We're still, storing carbon and nutrients in the soil, and we're building biodiversity. Secondly, is we're big espousers of compost. We believe that we should be returning vital nutrients to the soil. Some 40% of all the waste that ends up in our landfills, we could be returning to the soil through composting. It's very simple. Every human can participate in this incredible act of recycling nutrients. And so what we're teaching farmers is to put those nutrients back on your soil through composting. And then we're also espousing crop rotation. So farmers should not just be planting corn and soybeans, they should be planting a diversity of crops. And some of the rotations that Rodale prescribes, particularly in grain systems or in vegetable production systems, are very, very complex. A farmer might be growing 8 or 10 things in a rotation. So we're not just growing the same thing year after year after year. It would be like taking a medicine for 6 years and never changing that medicine or trying to wean off that medicine. We need to be building biodiversity by constantly changing what we're doing on that farm.
Yeah, thank you. And Monica, you love the microbiota, and I know that you know about how that microbiome that's in the soil gets transferred to the plant and becomes a part of us. Do you want to just kind of highlight some of that research and talk about the relationship between living soil, the plants that we consume, and our own microbiota?
So maybe just a definition to start. So like the microbiota is all of the bacteria, viruses, fungus that are all over our skin and anything that is exposed to the outside. And so we all have loads and loads of, I always call them the gut bugs that are that are all over our skin though, and they're in our colon and then our penis or vagina, more information than you wanted, but all over those places. And so all of those places in general, we want to have those bugs be healthy, but also to remember that there's lots of unhealthy bugs. And so each of the bacteria in our gut biome has its own DNA. So your bugs then have their own DNA. And so if you think about it, and a lot of people think that this is a funny correlation, but if you look at all the bugs and bacteria we have and all the genetic material that we have from our bugs, we're actually more bug than we are human. We're like 90% bug than we are and 10% human, in terms of genetic material. I think that's important to think about because you can then realize that those bugs really need to be honored and nourished, and so that's something that maybe we've forgotten over time. And those bugs they change from the moment you're born. If you're born by a vaginal delivery, you have the gut flora, your baby's gut will be the same as the bacteria in the mom's vagina. Or if you're born by cesarean, you have bugs that are like the skin of the mom. So just sort of to understand that those bugs are sort of happening and changing depending on what you eat and what your antibiotics you take. All of those things are affecting, and we're doing all these studies now that show that when you make changes in your diet, there's certain bugs that are associated with healthy living and some that are associated with poor living or illness. We did a study, Scott, you were involved in this, where we looked at patients and they were on a standard Western diet, and then we put them through a 6-day lifestyle change through one of your programs. And then we actually had the benefit of collecting their stool before and then after. That wasn't something they loved, but they did it, which we were thankful for. And what we were able to show was that within 6 days, we were able to change gut flora of patients or participants within 6 days. And it correlated with healthier habits. So we could see that as the healthy habits happened, so they were eating healthy foods and their blood pressure was going down, their cholesterol was improving. And with that, we were able to identify sort of those healthy bugs. So the gut biota is something that I'm obsessed with, because we're showing, and what I presented grand rounds today at UPenn this morning, I said the same thing. I said, what's important is that we're showing that outside of weight loss, that we're able to change people's clinical parameters, because so many physicians think that the reason diet works is because we make you lose weight. And so that's part of it, so certainly, but it's about the fiber, the phytonutrients, the nitrates in the food that all cause benefit to your body. And we were able to show that outside of weight loss, through the changes in the microbiota, we have changes in the clinical parameters. So then, if you believe that the gut bugs are changed by eating, then I should say that what did we do in our immersion? Well, in that immersion that we did with Scott, we gave patients 100% plant-based menu, and so in that they ate only plants. And so if you think about that, and so in that nourished with all that fiber and all those phytonutrients, we were able to make those healthy changes in patients. And then you think about those plants. Well, those plants, how are they good? How did they become good or healthy? Well, then that goes back to Jeff's conversation, which again goes back to the soil's gut bugs, so to speak, which is that basically if you have healthy bugs in your soil, you're going to have that healthy plant. And if you have that healthy plant, that's going to be full of phytonutrients. Imagine this: if you have bacteria in a bad virus or bacteria inside the soil, then the bacteria that are there, they have to get rid of it. They have to deal with that. Or if there's bacteria or a bad bacteria on the plant, then the bacteria has to be able to respond to it, similar to a human. And so then that plant becomes stronger because of it. And so then you eat that plant and you get the benefits. So that's a sort of a simplistic view, but I like to think of it as, the plant has to fight too. And as it fights, it gets stronger. And then as it gets stronger, we eat it and we get stronger. And so I think that's just so cool to have those connections.
It's an astounding relationship with a soil that is forgotten, in the halls of medical education and in the institutions that are training new doctors. And Jeff, isn't there research that shows that the soil and the microbiome ends up on the plant and actually becomes a part of our microbiome?
Absolutely. Yeah, there's no question that what is in the soil ends up or doesn't end up in the human body. Latest estimates coming out of our vegetable systems trial, which is one of the new seminal studies at Rodale Institute, that's comparing vegetable crops grown in a regenerative organic manner using cover crops and crop rotations and building healthy soil. And we're comparing that to conventional systems of growing vegetables using heavy tillage and lots of synthetic pesticides and herbicides. And early data coming out of that study are showing, last year there was purple potatoes that were sent off to a laboratory, a third-party lab for analysis. And just from that one crop, which was purple potatoes, some were grown conventionally, some were grown using organic methods, there were something like 26 phytonutrients and micronutrients in the purple potatoes that existed at levels 100 to 700 times higher in the organic potatoes than in the conventional.
Wow.
And so there's a dramatic difference. These two potatoes that to the naked eye look the same are actually dramatically different. And so you can imagine a person consuming that potato is going to have a very different health outcome. So we've at Rodale Institute, we partner with many research institutes and universities, but one of note in this conversation is the Penn State Hershey Medical Center, which is one of the largest cancer research institutes in America. They have been partnering with us on one particular amino acid that they found in their laboratory in isolated environments called ergothioneine. It's an amino acid that they found performs as well as chemotherapies in certain cancers to actually mitigate or kill cancer cells in an isolated environment. And so their own scientists said, where does ergothioneine come from? We have to learn more about this wonder amino acid. And would you believe they traced it back to the soil? And they found that ergothioneine is synthesized in the soil. And it has to be obviously the right environment, healthy soil. And so we've so depleted. So they're partnering with Rodale Institute to look at how we can actually improve or increase the amounts of ergothioneine in our soil. And it all goes back to how we manage that soil. We've actually proven that out, that the way you farm could actually eradicate this wonder amino acid, or could build it and enhance it and make sure that it's bioavailable. So that's just one example.
Yeah,
Awesome. I love that.
Awesome. For the curious mind, this is like the greatest mystery that is yet to be solved. And there's so much for us to understand. It is really, really exciting. I'm just going to make a note for those of you that are watching. If you have questions, down at the bottom, there's a Q&A bubble. And if you'll put your questions in there, we'll stop and take questions maybe in about 10, 15 minutes. And so we'd love for you to put your questions in there. The word regenerate means to like restore, renew, to bring something back to its original state. And it's a word that I love and I've been using in healthcare for a long time because that's always the way I approached my patients. But it's a word that's so relevant for, agriculture, the environment, and healthcare and individuals today. And so maybe, Jeff, you just mentioned talking about the regeneration of the soil, but how fast can we actually regenerate soil? I mean, the news is not so bad when about erosion and the 60 years of arable land, or 60 arable years that we have remaining, when we begin to understand that we can actually regenerate soil when we do the right thing. So maybe just tell us a little bit about the research at the Rodale Institute on the regeneration of soil.
Absolutely. I too believe that we're living at a moment in human history where the R's are more important than ever. Renew, restore, regenerate, redeem. I think that this is a very exciting moment to be alive because I think we're all waking up to the fact that we all play a role in this incredible process of restoring Mother Earth, of restoring human health. And it all does begin in the soil. Our founder's son, Robert Rodale, was also a visionary. And Robert Rodale did a lot of his seminal work in the 1970s and 80s. He was a world traveler. And during that time period, the word sustainability was really coming into the mainstream vernacular. And Robert Rodale despised the word sustainability. He actually felt that word was completely inadequate to describe the potential for agriculture and for the planet and for humans. He thought to himself, as he would travel around to these broken, desertified agricultural systems, what's here to sustain? Why would we ever call this sustainable agriculture? These systems are fundamentally broken. But then what he discovered is that when we focus our efforts on restoring the soil, regenerating the soil, that it actually regenerates very quickly. Like within a couple of growing seasons, we can build amazing amounts of fertility in the soil and build soil organic matter and restore vital nutrients. It happens really quickly. It's biology. It recovers just as the human body recovers. But then he went on to say, if we focus on that, if we focus on building soil health, the plants get healthier. The people consuming the plants get healthier. The farmer's bottom line improves. The whole community gets better and better. And so he thought about the word regeneration. He said that that's the more appropriate word. And so we really credit Robert Rodale for his, coining of that term as it relates to agriculture. And I think it's a concept. In many ways, it's a path forward for our world.
Yeah, that's beautiful. Thank you. I love that. We're in a generation of R's. The R's are important.
Can I ask a question to you, Jeff? If you don't mind, if I could ask a question. Jeff, how do you handle farmers who, in your area in particular, I guess, who are struggling with this sort of need to make income and sort of focusing and reminding them to think of the long game?
This is a great question, Monica. So Rodale Institute is actually working all over the world, but most heavily here in the United States. We now have a national consultancy. So we have a team of 15 full-time employees, and their job is to be out in the world all day, every day, holding the hand of farmers and helping them on a path towards embracing organic and regenerative organic production. And it's been amazing. We're only 31 months into even having this consultancy, and the demand for the service is unlike anything we ever imagined. We have over 400 farming clients that we manage, representing hundreds of thousands of acres. And frankly, they're starving for this. They're starving for help. Farmers need technical assistance. They need access to markets. They need science. And frankly, that's not being offered. It's not being offered right now at the university or the land grant level. So Rodale is really filling a unique void. Certainly, we have policy changes we need to address, and some of those are being addressed. But it's really, when you ask the question, what's holding us back in this conventional system, which I would argue there's nothing conventional about spraying chemicals, right? But what's keeping us stuck in this perpetual broken system is number one, lack of information. So farmers that want to transition don't have a place to go to get advice, and now they do through Rodale and many other great organizations. They also need food companies. They need markets to commit to them. We can't have fickle markets. We need food brands and large purveyors of food to commit to our farmers and give them healthy long-term contracts, because this is a biological process. Farmers need to invest in their land, and that's not 1 year. That's a 3 to 10 year time horizon. So we need big food companies to really get behind this. And then lastly, we need to change our banking systems and our lending institutions to be less risk averse. Right now they're not giving access to capital to farmers for doing something new and innovative. They want farmers to do what they've always done because that's safe. And so Rodale is single-handedly trying to redefine all of these systems, and we're making progress. So this isn't going to be an overnight change, but farmers are hungry. I think farmers want it, and we need all the consumers, everyone listening tonight, to understand that they play a role. And Dr. Stoll says this all the time. The reason we called the white paper that we co-authored with the Plantrician Project The Power of the Plate is because consumers actually play a role by voting 3 times a day based on what they put on their plate and how what they put on their plate was produced. And if we continue to support that system, then farmers are going to want to move in this direction because the market will be there to catch them.
Yeah,
Thank you.
Brilliant. Thank you, Jeff. That is great. And Monica, in healthcare, it's the parallel is really amazing, that the body recovers in the same way the soil recovers, right? And you've seen that in your practice as a cardiologist working in lifestyle medicine, that the body can be damaged for decades, but in a relatively short period of time, just like the soil, it rebounds. And so maybe can you just take a couple of minutes and highlight some of the research that you've seen with the regenerative capacity of the body?
Yeah, I always tell people that the body is very forgiving, because there's so many things we do to it over every day, and it continues to restore and recover, and it's such a beautiful thing. I think that there's so many things that you can make impact and change within days of healthy eating. We have seen that in studies. I mentioned the one we did with 6 days. There's studies. There's a great study where they looked at African Americans and Native Africans. This is sort of a fun one, where they looked at, and this is a study I didn't do, but where they looked at Native Africans were eating a village agrarian diet, primarily a farm diet. If not to say that that's really a word, but and then compared it to a city diet, and they call the SAD diet, or the standard American diet. And when you looked at those two groups, and they looked at their colons and did colonoscopies on these patients, and they found polyps in the African Americans, and they found no polyps in the Native Africans. But what was more interesting was they had totally different gut flora. Their gut flora of the Native Africans and the African Americans was totally different. And their short chain fatty acids. So short chain fatty acids are production of the gut flora or the gut bugs. And the short chain fatty acids, the higher the number or the higher the amount of them, the better, because those are anti-inflammatory. Again, my big word is anti-inflammatory when in my patients in my clinic, in my own life. And those short chain fatty acids are anti-inflammatory, anti-neoplastic, meaning anti-cancer causing. And so you want to have a lot of these short chain fatty acids in your body. And they found that the Native Africans had loads of short chain fatty acids, and the African Americans had just so much fewer. And so a lot of people might criticize that and say, well, they're just genetically different. Like who cares? They're different populations. So is that really true? So what they did, and the best part of this is that they didn't just leave it there. They switched their diets. So they gave the Native Africans, they gave them the African American diet, and the Africans, they gave and vice versa. And what they found is that all of a sudden the short chain fatty acids in the African Americans started going up. The gut flora started changing for the African Americans. And similar to the Native Africans, they started having their gut flora change, and their short chain fatty acids went down, their inflammation went up, and the polyp production went down in the African Americans. And it's just so cool. And that happened within 2 weeks. So within 2 weeks, you can make that much change. Within 6 days, we showed in our study that you can change gut flora. Within 2 weeks, we showed there was a decrease in inflammation, change in the short chain fatty acids. So you can make impact in your diet and your life within just a couple of weeks. And so I think that's what's really important that I always want patients to take home. And, a lot of people will tell me, because, I don't always see people, I see a lot of non-believers. This is a community probably of a lot of believers, but I have a lot of people who come in that, and I also practice in Florida, and they'll say, Doc, I've been eating meat and potatoes for the last 40 years, and this is how I've eaten. This is how I plan to eat. This is it. And so I often tell people, like, well, listen, here's the thing. What you've been doing isn't actually working, right? Because you're here seeing me as a patient, and you had stents put in. And so there's got to be another way. And then when I remind them that even though you've had this sort of lifestyle for so long, within just a couple of weeks, I always tell them, give me a couple of weeks. And if I fail, I will take you to the best steakhouse in Orlando or Gainesville, wherever I am at the time. If I fail, I will take you out to that, and I will sit there and watch you eat. And so that's our deal. I have this bet with them that I do with all of my patients. And I say, just give me 6 weeks. And I will tell you, I have never done that. I've never gone to the steakhouse, but I always promise that I will absolutely do it. But nobody has to go or I don't have to go, because everybody gets better. And so I just think that that's really important to note, that in 6 weeks, you can make somebody feel better. You can make them, their hearts better. You can make their inflammation better. And you change their gut flora, like you're changing everything in just a couple of weeks. And so I think that that's the piece of hope that I like people to take with them, is that, yes, you may have an illness. Yes, you may be sick, but that's okay. We can make you better. And just like soil can regenerate and plants can come back, we can also come back. We just have to take that first step.
Yeah, that's the beautiful message that is not being shared today, even in the midst of people, talking about the crisis that we have. People aren't talking about the hope-filled message. That in a couple of weeks your body starts healing, and a couple of years you're building inches of new topsoil. It really is incredible. We're going to take 5 more minutes with you two, and then we'll answer some questions. Jeff, I want to ask you this question. First, I want you to tell people about the new regenerative label from Rodale. And then I want you to answer the question, because it comes up so often: can we grow enough food through regenerative models to feed the world?
Sure, absolutely. So yeah, we're all beginning to hear the word regenerative come into the conversation. Food marketers are talking about it, and consumers are talking about it, and it's a very exciting time. I think we talked about the power of the R's, and I love that the word regenerative is seeping into mainstream consciousness. At the same time, Rodale Institute wanted to really step out ahead and lead. And we helped to start what is now the National Organic Program, which is housed inside of the USDA over 20 years ago. So when you go to the grocery store and you see that USDA organic logo, the science of Rodale Institute and the leadership at Rodale really helped to create that legislation. Unfortunately, though, any great industry should innovate, right? And we shouldn't be doing something 20 years later that we were doing then. And so, as Rodale Institute has joined forces with other leaders in the food industry to help put pressure on the federal government to innovate the organic standard, we've been met with a little bit of resistance. And so we felt this is our opportunity to lead out ahead and create a newer, even higher bar standard in food production. And so we call it the regenerative organic certification. If you're interested in reading more about it, it's just regenorganic.org. And what we're saying to food companies and to farmers is that the certified organic standard, that's just baseline. Everyone starts there. And then building on top of that, we're looking at 3 other pillars: soil health. How am I treating the soil as a farmer? How are the humans being treated in the farming system in which I'm a part of? And then thirdly, if there are animals in the system, are those animals being treated in the highest degree of humanity? And so the ROC certification is the newest, highest bar standard in food production. And we're just unbelievably overwhelmed with excitement from the food industry, from farmers. We're seeing dramatic adoption of this certification. We know that it's going to take time for brands and producers to get there, but they're jumping in with a lot of enthusiasm. And so I'm very encouraged by that. To your second question around, can regenerative organic agriculture feed the world? I think my question back to that would be, how could it not? We need a food system that can not only heal people, but also take care of people that are part of that food system. We need our soils to heal. We need a planet that is life-giving and life-affirming. And so the only way we're going to get there is by creating a food system that stands on the regenerative organic model. And our science has proven out that there's plenty of food that can be grown, that we can yield enough using these biological systems. And so I think we're seeing all farmers beginning to realize that this way of doing it maybe perhaps was a bit antiquated, and now it's time for us to turn towards these more innovative, higher bar approaches. So it's very exciting.
And Jeff, isn't one of the solutions kind of a decentralization of big ag, like all the way down to encouraging individuals and families to start growing some of their own food?
Absolutely. We've seen sort of like a 70-year march away from that decentralization. In 1945, like during the World War II years, almost 50% of all the food put on our tables in this country was grown in our own backyard. So like 45% of all the produce was grown in people's backyards. And today, almost 20% of all the food in the grocery store is coming from other countries. So in just 7 decades, we've seen this dramatic march away from empowerment of food production. And now what was so interesting was to watch human behavior during the pandemic. What happened over the last 18 to 24 months was quite exciting, in my opinion. The National Gardening Association reported in 2020 that 22 million new gardens were planted in America. And something like direct farm sales. So people connecting with farmers in their own community through farmers markets and other means, we saw an increase in direct farm sales 420% year over year. And so in a very short amount of time, we've decentralized the way we purchase and interact with our food system. So we can do this. And I think it's an exciting time to be alive. I think if we can reconnect people with soil and nature and food and how that food was produced, the healthcare situation will just take care of itself.
Beautiful. Thank you, Jeff. Monica, I have a two-part question for you. First, similar to Jeff, can healthcare actually shift in the direction of value-based care and lifestyle medicine? And then secondarily, like through an intersectional lens, how can we as healthcare providers help create this relationship with local organic farmers in a meaningful way?
So the first part of the question, I'll have to answer similar to Jeff and say, how can it not? And so, sort of joking aside, but I agree with that, is that people are starting, so payers, so insurance the payers, we call them the payers, the insurance companies, they are only currently built on acuity-based care, not only, but primarily, I should say. So in other words, that the hospital, just to clarify that means that the physician, the hospital and the clinic where you are being seen will make more money the sicker you are. So that's a fundamental thing to just sit on for a second. So wait a second. So if I'm in the hospital longer, the payer pays more to the hospital. Yes. Yes and no. I mean, there are maximums, et cetera. But the concept is basically that the sicker you are, the more acuity you have. That means that I had to spend more time with you as a physician, which then made me bill higher. If you're admitted to the hospital, the more acuity you have, the sicker you are, requires more acute medicine, which requires the payer to pay more. And that's the way the system is currently built. But what's happening is that there's a lot of demand from patients. One of the communities I work in particular is an area called the Villages, and the Villages is a fascinating population in Florida. It's a senior living community, but of hundreds of thousands of seniors, and they've started demanding value-based care, and they want primordial prevention, and they want to focus on healthy living. And so slowly payers are now having to respond to that and are providing more, putting more in at the beginning, because the truth is the models that are showing value-based care actually saves people money are there. They're starting to come. But it's, again, like the long game for the farmers. It's the long game for the health system. They have to appreciate that they're going to have to put money in at the beginning and lose. They're going to probably lose at the beginning because they're going to have to put so much more money in at the beginning. But the long game is people are going to be less sick, less patients in the hospital. And so that's actually better for the payer. And so I think that eventually we are already shifting that way slowly in small communities. And I think that eventually this is coming. There are already codes in our newest medical coding systems that are shifting towards time-based management and focusing more on sort of lifestyle-based practices. But we have so much to go. But I think more and more pushing is key. And as doctors, we can push that as well, which is that when we can start demanding as physicians, we can start telling the hospitals that working on that we work in, that we want to provide these kind of services, which is what I do all the time. And then they start realizing that this is a need that they have to fill because patients want this. Prevention is what people want. Regarding your second question, how can physicians connect to farms more? One of the things that we started doing at University of Florida is we started making a connection with the farms, where we had actually the farms bring food, their CSA, but actually having tables to sell food at the hospital and the clinics. And the Four Roots Farm, which I'm part of now, we actually bring food to hospitals and we sell it at a low cost to the hospital employees and the staff and the patients. And what's fascinating is they love it. I mean, no surprise to us, but it's surprising to the hospital is that they love it. They love it. It is one of the highly coveted events that happens at the hospital. And so I think as physicians, we need to push our hospitals to offer these services. Hey, why can't we have places like Four Roots and Rodale bring foods in and offer these services? And so I think if the physicians start demanding and the patients are starting to demand, we will change the system. I'm fully confident of that because we're already seeing it. There's a ways to go, but we're on the road.
Yeah, that's right. These are the creative ideas and solutions that actually help to reimagine a new system. That's right. Thank you. We have a lot of questions. We'll just take a few so we don't run too late this evening, but this just tells me that we're on a good topic that's very interesting to people, and it's a topic that needs discussion, because out of these discussions, even this evening, I have ideas that have been generated through this beautiful conversation. So I'll start with this question. It's a good one, and you can both answer. So we constantly hear that organic food doesn't have a different nutrient profile compared to conventionally grown food. Is there a bigger difference in the nutrient profiles of food grown via regenerative organic methods? And if so, any studies? And I know, Jeff, you mentioned that earlier with the vegetable systems trial, but any additional information on that?
Sure. Yeah, I would encourage people to visit Rodale Institute's website and click on the vegetable systems trial tab. You'll see plenty of published peer-reviewed studies that have come to the fore in the last couple of years. The short answer is yes, there is a dramatic difference according to our science. The recent data that I just presented last week at a conference is that the squash and corn samples taken out of the VST this past season showed 2.5 times more protein content in both corn and squash. And that probably doesn't mean much to the audience, but protein is actually it's an indicator that nitrogen uptake is maximized. So if you see elevated protein levels in a plant, that means that it's maximizing its nitrogen availability, which means that its nutrient uptake is maximized. And so to see such stark differences, 2.5 times more, is dramatic and substantial. And so this is just one example of the many examples that we have coming out of this one study. But yeah, there's absolute stark differences in nutrient profile.
Yeah, great. Thank you. I'm going to combine a couple of these questions because it has to do with cost, which is often a barrier for so many services and also for farmers. So one question, Jeff, specific to you, is that the certified organic certification is expensive and cumbersome for farmers and can limit farmers stepping into that arena. Do you have any ideas for addressing this?
Sure. First of all, it's about upwards of $500 to $1,000 a year. So that's just to give you a framework for the cost of a certification. That's an average farm, a vegetable operation. Um, it certainly varies state by state, but there is an organic cost share program that's available federally and from the state. And so there's actually federal and state money available to pay the farmer to get that certification. In addition, Rodale is offering free consulting services to farmers in most states. And so we're really one by one eliminating the barriers that would make it cost prohibitive for a farmer to get the certification. And then the farmer is going to earn between 20 and 40% premium on the crops produced when they carry that certification. So there's a price premium on the back end. So I think we have to get past this misnomer that organic certification is a barrier. It's just going to take a little bit of ingenuity from the farmers to seek out that funding.
Yeah, great. And the second one, Monica, maybe you can start and build on what you spoke about earlier. But the question is, how do we ensure that organic or regenerative organic foods are accessible to people of all income brackets? If we're believing that by the research these are more nutrient dense and hold some benefit in regenerating bodies, how can we make them accessible?
Yeah, so this is a good question and somewhat of a tricky one, but definitely something that we all have to work together on. So often patients ask me in clinic if I can't afford organic food, and what should I do? Should I eat the raspberries that are non-organic, or should I not eat raspberries? Or what should I do? And so my answer to that question is eat the raspberries. And so, because I would rather you eat the raspberries that are made conventionally, if you can't afford the organic, than not eat raspberries. Again, it's imperfect, I realize. We would all love to eat organic, but I appreciate that it's $6 for a thing of raspberries. I have 3 kids and they can inhale them in 3 seconds. So I get that. So, but then there's frozen organic is sort of another option. Again, not perfect. So that's one thing. But eventually, as things start changing, things are going to start getting less expensive. The best thing that I really that we can do now is go to use the farmer market. So the farmers markets are a really good way to get sort of lower cost foods, and accessible through multiple food brackets. Also, because remember, a lot of the food farmers markets take SNAP. So a lot of even the people who are using SNAP programs, they can use their funds at farmers markets, and almost every farm uses and will honor SNAP. And so that's important to sort of know, is that you can use those farmers markets. And I really do encourage that in particular, because that helps the farmers, that helps the people, and every bracket of people can afford the foods that are there. And then there's more opportunity to eat those organic foods. And remember, the food is the best when it comes off the plant anyway, right? The nutrient quality just diminishes over time. And so if you get it from the farmers market, you're getting the highest nutrient potential as well. So lots of reasons to support the farmers in the farmers markets.
Yeah, great. Jeff, anything additionally?
Yeah, absolutely. I think it comes down to a reordering of priorities. We need to reorient ourselves around the table. Monica talked about this earlier. We need families to put a higher priority on their household expenditure on food, and it might mean that something else has to be sacrificed. But when, from the little I know, medicine is very expensive. I have a person in my circle who relies on diabetes medicine on a monthly basis. He told me it's $600 out of pocket for that medicine. So it's a reorientation of priorities. At Rodale Institute, we believe in building disruptive. Yeah, we believe in building disruptive models. We built a program called the Agriculture Supporting Communities Program. It's a way that we train young farmers to learn how to become an organic farmer. They train for a growing season with us, and the net result of that is we grow a bounty of food that we don't have a market for. So we now truck that food into inner city Allentown, Pennsylvania, inner city Reading, Pennsylvania. These are 2 very low income, low access communities that are just 12 miles in either direction of the Rodale Institute. And we sell that produce to low income, low access families. And for $15 to $30 a week, we're feeding an entire family certified organic food, the highest quality. And so, and I absolutely agree with Monica, farmers markets are the perfect way to cut down on the cost. Learn to grow something in our own backyards. I think it's a supply and demand issue. We're going to drive, the more we demand organic food, we're going to drive the prices down. And we also need doctors in our clinics prescribing food as medicine, prioritizing expenditures on food, because there's a net savings on the back end that we all can realize.
I also, just one last thing is, I also think it's super important to look at the farms in your area. Like, I don't think people realize where so much of the time the farms are. That allows you to have opportunities to get food that's really close to home. For instance, the Four Roots Farm we've put a Four Roots Farm in the middle of a community, just like Rodale, which you said is 12 miles away from sort of a low income area, is also in that lower in an area where there's a lower income bracket, and we're trying to bring those people from those communities into the farm. And so if we teach people about how food starts, then they're going to want, and then the pesticides versus non-pesticides and organic gardening and the importance of those and how it affects your food, then you're going to make an educated consumer, and then they're going to all naturally choose those kind of healthier foods. They're going to choose farmers markets, and they're going to choose growing things in their backyard, as Jeff said.
Yeah, that's exactly right. And, all of this goes back to a change in thinking, a new mindset. I love what you said, Jeff, about, kind of a recalibration of our thoughts around the pricing of food. And for years, I've told my patients that they need to move their expense for food out of the expense category into their investment category. Right. Because when it's in your investment category, you're actually thinking about the long-term implications of the way that you're spending food, and you're trying to get a return on investment for the money that you're spending on food. But we have this mindset that's been developed in our culture today of like cheap appreciation of cheap, voluminous food and high volume, cheap food. And it's actually the wrong mechanism for every reason. So I really like that idea of recalibrating the way that we think about food and understanding that, we're going to get the quality for the money that we spend. We have more questions, but we're at 7:15 here in Tennessee and 8:15 on the East Coast. And I see this as such an important topic. So we're going to circle back and do another one of these and continue this conversation. Because I believe that, for me, out of this conversation, I even walked away with more hope than when I started, because I see the solutions. The agricultural supported communities are a solution. The Four Roots is a solution for healthcare. There are so many solutions that have been yet to be developed. When I was in practice, despite my medical training, I used to always ask myself the question, like, what is the solution? Because I was trained so often in my training, you get to the end and there's no solution, so you either refer them out or you tell them they're going to have to live with it. But I would always challenge myself and say, well, what is the solution? There's got to be a solution. And just because I don't know it doesn't mean there is not a solution or one yet to be discovered. And I think, the challenges that we may see in transitioning the way that we grow food, transitioning the way that we deliver healthcare, require us to ask those same kinds of questions, like what is the solution? And then be willing to explore all options and discover through curiosity these amazing solutions that empower local communities, empower farmers, regenerate soil, regenerate people, and create a new healthcare system that empowers local communities and individuals and supports long-term regeneration. And so, that's, as I walk away this evening, that's my takeaway, is I'm going to continue asking those questions with a lot of curiosity. So I want to thank both of you this evening, Dr. Monica Aggarwal, Jeff Tkach, for being my friends, for joining me this evening on this really dynamic conversation, and for sharing with us, your very thought-provoking ideas. Thank you.
It's been a pleasure. It's been an honor. Thank you so much.
Me too. I really enjoy this, and I feel like together we're going to change the world, baby. Let's do it.
We are. That's right. That's right. And we're reimagining. I've been studying imagination recently. We're reimagining the future in conversations like this and programs where we think solution-based. We're imagining a different solution. And when we start by changing the way that we imagine the future, we will discover things that we never imagined possible. And that's what this evening's done for me. And I want to thank all of you that joined us this evening. You are a part of this incredible community. You're a part of the solution that is changing the world. And I thank you for joining with us on this long journey. I met many of you 10 years ago. I think, Monica, you and I met almost 10 years ago, right? And So we've been on this journey together to change the world, and we are seeing incredible changes, things that I didn't imagine possible 10 years ago.
Awesome.
And I just want to thank all of you for joining us this evening, for being a part of the Plantrician community, for the lifestyle medicine community. And we hope to hear your feedback on this. And if you would like to support the Plantrician Project, plantricianproject.org, there's a donate button. And join us in these new initiatives next year as we work together to bring about transformation. Wishing you all a wonderful holiday season. And thank you again for joining us this evening. Good night.
Thank you so much.
Thank you.